All right, group, let's go ahead and get into Unit 8, where we're going to talk about a new family today. We're going to talk about the Streptococciaceae. Specifically, the Streptococcus is what we're going to talk about. And today we're going to talk about two of the groups of Streptococcus, and that would be the alpha hemolytic Streptococcus and the beta hemolytic Streptococcus. So there are many characteristics common to Streptococcus and Enterococcus. And if you're wondering what an Enterococcus is, it's basically a Streptococcus of the gut. Entero means of the gut, and cocci means cocci, circle. So an Enterococcus is a Streptococcus of the gut. So when I talk about the Streptococcus, I'm always including the Enterococcus as well. So some characteristics that are common to the Streptococcus and Enterococcus is that they're all gram-positive cocci, and they are often in chains. They can be in pairs. Our Streptococcus pneumoniae is often seen in pairs. Okay, the cocci can be elongated. That's what we call lancet-shaped cocci. Streptococcus pneumoniae can have lancet-shaped cocci. They are facultative anaerobes, and they may prefer a capnophilic environment. So most of our Streptococcus and Enterococcus are facultative anaerobes. However, the alpha hemolytic Streptococcus are capnophilic organisms, so they prefer 3 to 10% CO2. Some are fastidious, and it's those alpha streps again that are fastidious. They're catalase negative, and if you recall from the last unit, our Staphylococcus are catalase positive, but our Streptococcus are catalase negative, and they will not reduce nitrates to nitrites. And of course, Staphylococcus does reduce nitrates to nitrites, but Streptococcus does not. Okay? So Streptococcus is unique. When you gram stain it, it is a gram-positive cocci in chains, and you can see that on the image on the right. And on the image on the left, you can see that Streptococcus grows in what looks like puffballs in a broth. If you recall, Staphylococcus grows as streamers in a broth. Streptococcus is totally normal flora in mammals, and you can find it in the upper respiratory tract. That would include the mouth, the throat, and the nasopharyngeal and oropharyngeal area. They are also found normally in the gastrointestinal tract and also the genital tract of females. Okay, there's a multitude of different gamma and alpha hemolytic streps that are found in the upper respiratory tract, the gut, the genital tract. Some beta hemolytic streps can actually be normal. You can also find Streptococcus in nature. You can find Streptococcus in water, vegetation, and dairy products. Now, there's a number of types of media that we can use to isolate and actually encourage the growth of Streptococcus. Blood agar is primarily the media that we will use in student laboratory to grow our Streptococcus. And blood is really nice because you can see the degree of hemolytic activity on the plates. Okay, this is also known as tryptic soy agar with 5% sheep's blood, but it's the same thing as 5% sheep's blood. We can also use PEA or CNA plates, which is phenyl ethyl alcohol agar or Columbian nalidixic acid agar, and these are enriched and they are also selective for gram-positive organisms. So our gram-positive organisms will grow on PEA and CNA, but our gram-negative organisms, kind of like our E. coli or Klebsiellas, are going to be suppressed. Then we can have strep selective agars, which inhibits other organisms, but it is selective for certain things like Streptococcus pyogenes. And then we have broth medias. And there are some medias that are good for Streptococcus agalactae, like carrot broth and Todd Hewitt broth. Carrot broth is really good for the identification of the beta hemolytic strains of strep B, and Todd Hewitt broth is also good for the identification of strep B as well. Now, when looking at our plates, our Streptococcus look quite a bit different than our Staphylococcus. Streptococcus are a little bit smaller than staph colonies, and usually they're considered small to medium. Some of our alpha streps are very, very small, and then you get up to the Enterococcus, and they're more like a medium size. Their consistency can be dry or mucoid, but generally they are just damp looking, and some pathogenic strains can have a capsule. Our Streptococcus pneumoniae can often be mucoid because it has a capsule. And they can be either alpha, beta, or gamma hemolytic, and that's their effect of their toxins and enzymes actually on the sheep cells in blood agar. And we're going to talk more about that on the next slide. So whenever we're first trying to identify our streptococcus, the first thing we do, of course, is a catalase, and they're going to be catalase negative. Then the second thing that we need to do is determine if they're alpha, beta, or gamma hemolytic organisms. And that's going to determine the next phase that we go to in our algorithm for identifying our streptococcus. So an alpha hemolytic streptococcus is a streptococcus that produces toxins or enzymes that partially lyse the cells around the organism in sheep's blood agar. Beta hemolytic organisms are organisms that completely lyse the cells around the colonies on sheep's blood agar, and gamma hemolytic organisms are organisms that are non-hemolytic, so they have cellular products in the media that are not going to actually affect the media. There's some really nice examples in your book. I would highly recommend that you take a look at the Streptococcus chapter, and that way you can see the difference between alpha, beta, and gamma hemolysis. Now this slide shows the difference between alpha, betas, and gamma hemolytic organisms. The image on the top left, this is an example of a mucoid Streptococcus pneumoniae. You can see that it's got the isolated colonies, and then around each colony it's got a dark green circle around each colony, and that's because it is alpha hemolytic. And what I mean by that is this particular organism produces toxins or enzymes that actually partially destroy the red cells in our sheep's blood media. The image on the top right is an example of Streptococcus group A, or Streptococcus pyogenes, and this happens to be a beta hemolytic organism. And you can see that the cells in the media are completely destroyed by the toxins or enzymes being produced by that microbe. And then if you look at the image on the bottom, that's an example of a gamma hemolytic organism, where the organism is just sitting on top of the media, but there is no lysing of cells in the media at all. So that's the difference between alphas, betas, and gammas. So like I said, whenever I'm talking about the Streptococcus, I'm also talking about the Enterococcus species. Enterococcus means strep of the gut. Entero means of the gut, and this of course is a Streptococcus. They are actually grouped with the Streptococcus when you're trying to identify them. They used to be known as group D strep, but that's kind of an older term. We don't really use that anymore, but you might find some old school texts that still refer to Enterococcus as the group D streps. From here on out, whenever I'm talking about the Streptococcus species, I'm also including the Enterococcus genera as well. So when attempting to speciate the Streptococcus or Enterococcus, one of the first things we want to do, of course, is a catalase, and they're going to be catalase negative. But then how else do we go about identifying these organisms as unknowns? The first thing we want to do is we want to look at their hemolytic activity. If they're alpha hemolytic organisms, remember they only lyse part of the cells in the media. If they're beta hemolytic organisms, they're going to lyse all of the cells around the colonies in the media. And if they're gammas, they won't lyse any of the cells in the media. Okay? The hemolytic properties of all unknown streps must be evaluated on blood agar. Okay? Also, when we're attempting to identify Streptococcus and Enterococcus, we want to look at their physiological characteristics. Are they pus producing, or are they pyogenic? Are they necrotizing strains? These are all things that we have to ask ourselves when we're attempting to identify our Streptococcus and Enterococcus down to the species level. Then we can look at serological types. These are based on carbohydrates found on the walls of beta hemolytic Streptococcus. Beta hemolytic Streptococcus can be serologically typed, and this is called Lancefield typing, named after a woman by the name of Rebecca Lancefield, who actually studied the carbohydrates found on the cell walls of beta hemolytic Streptococcus. So Streptococcus pyogenes can also be referred to as Streptococcus group A, and you're going to eventually learn the scientific names and also the Lancefield names of all the Streptococcus. And then finally, when attempting to speciate strep and Enterococcus, we want to look at their biochemical or metabolic activities as well as their enzymatic activities. So on this slide, we have several tests that are used to identify the Streptococcus and the Enterococcus, and sometimes we're going to use some of these tests, other times we'll use other types of tests that are on this list, but essentially what we're going to do is we're going to evaluate the hemolysis of the organism. We're always going to do a catalase test. In some cases, we'll do bacitracin, SXT, bile esculin, and salt tolerance tests. We may do LAP tests, PYRs, optogen or biosolubility testing, serologically typing our beta streps, or we may be doing a CAMP test or sodium hippurate test. So this is kind of the longer list of all the tests that we would do to speciate our streptococcus. And we'll talk about all of these tests in the upcoming slides. Now, the catalase test is one of the first tests that we do to identify Streptococcus species, and the principle is exactly the same as the principle that you learned for Staphylococcus species. The presence of the catalase enzyme combined with 3% H2O2 results in bubbling. Streptococcus are almost always catalase negative, and there's going to be no bubbling when the test is performed. Staphylococcus is going to be catalase positive. So Staphylococcus is catalase positive, where you're going to see bubbling, and Streptococcus is catalase negative, where you're going to see no bubbling. Now remember, when doing the catalase test, you always want to be careful to avoid getting chunks of blood agar in your test, because chunks of blood agar can give you false positives because of the peroxidase in the red cells. One test that we can use to identify our beta hemolytic streptococcus is susceptibility to bacitracin. The bacitracin is also known as the A disc because it was once used as a good screening test to determine if we have Streptococcus group A. Also, the A disc can be used to differentiate Staphylococcus from Micrococcus. If you recall from the last lecture, Staphylococcus are resistant to the A disc and Micrococcus are sensitive to the A disc. So the A disc is mainly used to identify an organism known as Streptococcus pyogenes. This is also known as Group A Streptococcus. If the organism is inhibited by 0.04 units of bacitracin, then we can presumptively say it's a Streptococcus pyogenes. Now we have to confirm that. This is just a screening test, but we're looking for any clear zone around the disc. There's no need to measure that zone. Any clear zone around the disc means that you have a bacteria that is sensitive to bacitracin. Another test that we can perform, especially to identify the beta hemolytic streps, is setting an SXT disc. So we'll make a plate of our organism and we'll put the SXT disc on it. Streptococcus pyogenes is resistant to SXT and it grows right up to the disc, while Streptococcus group C and Streptococcus group B, these are both beta hemolytic streps and they are both sensitive to the SXT disc. Sometimes we can set up bile esculin and salt medias to determine the species of an organism. These are usually set together, okay? So the bile esculin and salt tests are usually set together to determine if we have an Enterococcus or some other Streptococcus species. In the bile esculin test, we're going to set up a bile esculin slant or broth to determine if our organism can hydrolyze esculin. If it can hydrolyze esculin and make esculitine and also live in the presence of bile salts, then of course that is a positive test. Most Enterococcus are sturdy streps and they can actually survive bile salts and will hydrolyze esculin. The salt tolerance test is used to determine if our organism can actually survive 6.5% salt. If you remember from the last lecture, Staphylococcus can survive 7.5% salt, but most Streptococcus cannot survive salt or sodium chloride. However, Enterococcus, like I said, is a sturdy strep and it can survive 6.5% sodium chloride. Other tests that we can do to speciate our organisms are the LAP test and the PYR test. Usually the LAP test and the PYR test are used to determine if we have an Enterococcus or a strep versus another type of aerobic gram-positive cocci. The LAP is used with PYR to determine if we're dealing with a Streptococcus organism or some other non-strep aerobic GPC. Streptococcus are usually LAP positive, while our leuconostocs are LAP negative, and Aerococcus is an organism that is variable. PYR can be used in conjunction with LAP to determine if we have the enzyme pyrrolonidol aminopeptidase, which will hydrolyze PYR. That equals a positive test. If you have a positive test for PYR, then you're dealing with the Streptococcus pyogenes or an Enterococcus species. The optogen susceptibility test and biosolubility test are usually used to determine if we have a Streptococcus pneumoniae, which is a type of alpha hemolytic strep. The P disc is also known as the optogen disc, and the P stands for a word known as pneumococcus. That's kind of a nickname for Streptococcus pneumoniae. Streptococcus pneumoniae are actually sensitive to the P disc, and when you set up a P disc on a plate of Streptococcus pneumonia, you're going to see a zone size of 14 millimeters or greater. The biosolubility test is used to identify Streptococcus pneumoniae. Pneumococcal cells will lyse in the presence of 5% sodium desoxycholate at a specific time interval. So the bioesculin test, what you do is you take a plate of your Streptococcus that you're trying to test, and you put a drop of the 5% sodium desoxycholate on your colonies, and then you incubate it for a half hour. If the colonies disappear, then we say that they are biosoluble, and if they're biosoluble, then they must be Streptococcus pneumoniae. Here's an example of an organism with the P disc. The P disc is right in the middle of our plate of Streptococcus pneumonia, and if you were to measure that clear zone of inhibition around that disc, you can see that it's much greater than 14 millimeters in diameter. Because it is greater than 14 millimeters in diameter, we can say this is a confirmatory test for Streptococcus pneumoniae. Okay, Streptococcus pneumoniae are alpha hemolytic, and they can be small with a central divot and have what's known as a penny edge. There are other more damp strains of Streptococcus pneumoniae as well. These mucoid strains are usually the more pathogenic strains due to their capsule. Rebecca Lansfield was an American bacteriologist that lived from 1895 to 1981, and she studied the immunochemical nature of Streptococcus. She determined that beta hemolytic strep can be serologically identified based on their specific carbohydrate antigens on the cell walls of these organisms. The principle is the cell wall antigens of unknown organisms are extracted from organisms, and their antigens are then identified by serological methods. So what happens is you can take an unknown Streptococcus and somehow rip the antigens off the organism and then serologically type. We can only Lansfield classify our beta hemolytic streps. So all of our beta hemolytic streps have a scientific name, and then they also have a Lansfield name. So Streptococcus pyogenes is also known as group A Streptococcus. Streptococcus agalactae is also known as group B Streptococcus. Streptococcus dysgalactae equi zooepidemicus complex, that's a hard one to say, is group C. That one we usually just refer to as group C. And Streptococcus canis is referred to as group G. The only ones that you need to know both the scientific name and the Lansfield name are the first two. Streptococcus pyogenes is also known as group A strep, and Streptococcus agalactae is also known as group B strep. The only gamma hemolytic Lansfield Streptococcus that can be grouped that is not beta hemolytic, the only gamma hemolytic are the group D streps. That's going to be your Enterococcus. But typically we don't group anything that isn't a beta. Other tests that we can do to identify our Streptococcus that are beta would be the CAMP factor test and the hypurate hydrolysis test. The CAMP factor test stands for Christie, Atkins, Munch, and Peterson. These are the four people that discovered this phenomenon. Strep agalactae has an extracellular protein that reacts with beta-lysine. The protein beta-lysine combination causes an enhanced hemolytic reaction that actually looks like an arrow. And I'm going to show you a picture of this in the next image. The hypurate hydrolysis test is a test that is for Streptococcus group B, but it is awfully unreliable and is starting to be phased out. So we're not going to be doing hypurate hydrolysis in lab, but I do want you to know the procedure. In this procedure, we take 100 microliters of sterile water and put it in a plastic tube. We add many colonies of our unknown organism, and then we add a hypurate disc to that tube. We incubate the tube for 2 hours at 35 degrees, and then we add 2 drops of ninhydrin. We incubate it for another 30 minutes, and at the end of that incubation period, you should have a purple color in the tube. A purple color in the tube indicates a positive test for the hypurate enzyme. So let me show you a couple pictures of the CAMP test and the hypurate hydrolysis test in the next slide. So in the image on the left, we have a blood agar plate, and the line that goes right down the middle is Staphylococcus aureus. Staphylococcus aureus provides the source of beta-lysine. And then perpendicular to that center line, we've got a strep B at the top and a strep A at the bottom. You can see with the strep B, there's an arrow-like formation that occurs between the junction of the unknown organism and the Staphylococcus aureus. That arrow formation is a positive CAMP test, and that confirms Streptococcus group B. If there is no arrow formation like you can see at the bottom of that blood agar plate, that means that you're dealing with a different beta hemolytic strep, probably Streptococcus group A or group C or even group G. If you look at the image on the right, this is an example of a positive hippurate hydrolysis test. The purple broth, after they've added the hippurate hydrolysis, the organism, and the ninhydrin, indicates that we have a positive test for Streptococcus group B, as in boy. So here's some general lists of the types of tests that we do to identify our alpha streps, our beta streps, and our gamma streps. Our alpha streps we usually use to differentiate Streptococcus viridans from Streptococcus pneumoniae and sometimes Streptococcus galolyticus. We would set up the optogen disc or the biosolubility test or bile-esculin and salt. For beta hemolytic streps, we would set up PYR or CAMP or bile-esculin or SXT, hippurate hydrolysis, bacitracin, or we could serotype them. And serotyping really is the gold standard for identifying our beta streps. The gamma streps can be identified by setting up a PYR, a CAMP test, and that's usually to rule out the non-hemolytic strep Bs, bile-esculin and salt, and hippurate hydrolysis. We use the tests on this list to differentiate Enterococcus faecalis from Streptococcus galolyticus and the non-hemolytic Streptococcus agalactae. So let's go ahead and get into the beta hemolytic streps a little bit. Remember, all of our beta hemolytic streps also have a Lancefield name. So Streptococcus pyogenes is also known as strep A, Streptococcus agalactae is known as strep B, and then strep C and G, you can just call those strep C and strep G. But there is a nice staph and Streptococcus schematic in your Mahan textbook. I would definitely look at that and maybe make your own schematic for lab. In Lancefield classification, what we're doing is we're ripping the cell wall polysaccharide antigens off of the beta hemolytic strep. So we take those extracted antigens and we chemically add them to latex agglutination particles. And if you have a clumping, it indicates which Streptococcus you're dealing with. So beta hemolytic streps can be Lancefield typed by serologically typing the cell wall antigens. Streptococcus pyogenes is strep A and strep agalactae is strep B. So when talking about the beta hemolytic streps, I want to talk about one of the organisms that is probably one of the most serious organisms you're going to see in a microbiology lab, and that would be Streptococcus pyogenes, also known as group A Streptococcus. This is always considered a pathogen in any body site, but most of the time you hear of this organism causing strep throat. Anytime we are dealing with this is a critical value and must be called to the doctor or the RN taking care of that patient. This is an organism that is beta hemolytic on blood agar. The hemolysin, streptolysin O and S account for the hemolysis observed on your blood agar plate. Streptolysin S is the beta hemolysin seen around the colony surface, and streptolysin O is the beta hemolysis seen around the colony subsurface. 5% sheep's blood agar is the media of choice for growing Streptococcus group A because this type of media actually inhibits other confusing organisms like certain species of Haemophilus. Streptococcus pyogenes is a serious pathogen because it can lead to all kinds of other problems. Most of the time when we're talking about Streptococcus pyogenes, we're talking about streptococcal pharyngitis, which is essentially strep throat. Okay, but Streptococcus group A can also cause impetigo, which is a skin infection. It can also cause cellulitis and scarlet fever. Usually scarlet fever, you have a rash due to the epidermolytic toxin. And then Streptococcus pyogenes can also lead to pneumonia. usually as a secondary infection, but most importantly, Streptococcus group A or Streptococcus pyogenes can lead to acute rheumatic fever or acute glomerulonephritis, and that's essentially what causes damage to your heart valves or damage to the kidneys. And then one other type of infection that Streptococcus pyogenes can cause is called necrotizing fasciitis, and that's the flesh-eating bacteria. There are a number of virulence factors associated with Streptococcus pyogenes. Some strains are actually encapsulated, so they have a capsule. Hyaluronidase is an enzyme produced by Streptococcus pyogenes, and it breaks down connective tissues. Streptokinase is another enzyme produced by Streptococcus pyogenes, and streptokinase breaks down fibrin. Also, Streptococcus pyogenes produces pyrogenic exotoxins, which is a fever-producing toxin. And they also produce M proteins. These are antigens that make the organism resistant to phagocytosis. Streptococcus pyogenes is a gram-positive cocci that is seen microscopically in pairs or in chains. If you want to see really nice chains, you can put the organism into a broth and then stain it the following day from a broth, and you're going to see those nice, beautiful chains. Macroscopically, or to the naked eye, they are tiny, dry, beta-hemolytic colonies after 24 hours of growth. You will see large zones of beta hemolysis that's observed. The colonies, like I said, usually tend to be rough and may actually grow better anaerobically, or certainly show more beta hemolysis if grown anaerobically. Remember, these are facultative anaerobes. So let me show you a picture of Streptococcus group A. So here's a nice picture of Streptococcus pyogenes on blood agar, and you can see that the isolated colonies are very strongly beta hemolytic. Whenever we're attempting to identify Streptococcus pyogenes, the first thing we want to do is determine its catalase. If it's catalase negative, then we know it is a Streptococcus species, okay? Then we have to evaluate its hemolysis. We know that it's beta hemolytic, so it's appropriate to set up the basotracin disc. If it is sensitive to the basotracin disc, that's a good preliminary identification of Streptococcus pyogenes. They are also PYR positive. Or if you don't want to do the basotracin test or the PYR test, you can actually serotype it, and it's going to clump with the Strep A latex. Other identification methods for identifying Streptococcus pyogenes would be fluorescent antibody typing, also known as FA, or miscellaneous serological testing such as ELISA testing. Next semester, you will have to instruct another student how to collect a throat swab. The number one cause of streptococcal pharyngitis is streptococcal pyogenes. But what we want to do is we want to approach the patient and identify ourselves to our patient and ask them if they've ever had the procedure done before. We want to don a face shield and ask them to open their mouth wide and to tilt their head back at a 45-degree angle and then say ah. And the reason we have our patients say ah is it prevents that gag reflex. Then we can insert the swab into the mouth, and we don't want to touch the inside of the cheeks. We don't want to touch the tongue or the teeth. Instead, we want to swab the tonsillar area at the back of the pharynx, the tonsillar area, and also the back of the pharynx. We remove the swab without touching the tongue, cheeks, or teeth, and then we perform rapid antigen testing and set a culture. So let's take a look at what a throat with strep throat looks like. People that have strep throat often have a throat that has red or white patches. The treatment of strep throat is penicillin. Streptococcus pyogenes is universally susceptible to penicillin. However, if your patient is allergic to penicillin, the second choice would be erythromycin, and finally the third choice of antibiotic would be clindamycin. So like I said, Streptococcus pyogenes is predictably sensitive to penicillin, so we don't need to do susceptibility testing. We just don't need to because we know it's always going to be universally susceptible to penicillin. The treatment is for 10 days minimum. Usually you're not contagious after the first day or two of treatment, but there are relapses that are very common when it comes to Streptococcus pyogenes. Let's go ahead and switch gears now and talk about Streptococcus agalactae, which is also known as Group B Streptococcus. Streptococcus Group B is a gram-positive cocci that's in pairs or chains. Usually it's in chains. It's beta hemolytic on blood agar, aerobic, and the colonies are larger than group A strep. You will see a zone of narrow beta hemolysis, and this is referred to as soft hemolysis. There are a few strains of strep B that are gamma hemolytic, but that's pretty rare. We always want to double check the identity of the organism to make sure it's not an Enterococcus species. The significance of Streptococcus agalactae is that it can cause lots of problems for little babies. It can cause neonatal disease. Women can actually be colonized with this organism in the vagina, and then if the baby is born through natural childbirth through the birth canal, the baby can actually pick up that strep B, and they can develop neonatal pneumonia, osteomyelitis, meningitis, and sepsis. So it's not dangerous for mom to be colonized in the vagina with strep B. However, if mom is pregnant, usually in the 3rd trimester, they will test mom for strep agalactae to make sure she doesn't have it, because she can transmit that onto her baby, and the baby can develop meningitis or septicemia. Streptococcus agalactae can be very virulent because it can be encapsulated. Now in that picture, those are gram-negative rods that are encapsulated, but I just want you to be able to see the capsule. Of course, Streptococcus agalactae would be a gram-positive cocci that's encapsulated. They can also produce cytolysins and cell surface proteins. Those are all things that cause them to be more virulent. So here we can see a picture of the soft hemolysis on the upper left in image A. We can see that it is beta hemolytic, but that beta hemolysis is much softer appearing than it would look for Streptococcus pyogenes. In image B, we can see their gram-positive cocci in chains. In image C, we can see the organism grows all the way up to the basotracin disc. And then in image D, that's the CAMP test, where the line across the top is Staphylococcus aureus, and then the line perpendicular is your Streptococcus group B, and it's forming an arrow. That is a confirmatory test for strep agalactae. So the best way to identify Streptococcus agalactae is to first do a catalase test. Like all of your streps, it is going to be catalase negative. We want to make sure that we understand it's a beta hemolytic organism, because the beta hemolysis determines what our next step in testing is going to be. We can set up an A disc, and it's going to be resistant to the basotracin disc. We can choose to set up a CAMP test, and this organism is CAMP positive. The organism is also hippurate hydrolysis positive. It's PYR negative, and the reason we would do PYR is to rule out strep A if it's a beta, or rule out Enterococcus if it's a gamma. It's bile-esculin negative. The salt tolerance is variable depending on if it's a beta or a gamma, but the gold standard for identifying Streptococcus agalactae is by serotyping it. It's going to be positive with the strep B latex. Streptococcus group C is an organism that can cause a mild form of pharyngitis. It won't lead to rheumatic fever or glomerulonephritis like strep A can, but it can still cause a person to have a strep throat. It is a beta hemolytic colony that looks a lot like strep A, but it's usually a larger colony. A lot of times strep C is mucoid as well. Serotyping to identify strep C is by far the gold standard. Other infections with this organism are seen mostly in immunocompromised patients, and this can lead to things like cellulitis, pneumonia, osteomyelitis, endocarditis, and septicemia. Remember that group A strep is SXT resistant, while group C is SXT sensitive. Group G strep is another type of beta hemolytic strep that can cause mild pharyngitis. Again, it's not as serious as Streptococcus group A, but it can still cause a sore throat. You can often find strep G in the upper respiratory tract of people, the gastrointestinal tract, and the genital tract. And it could be normal flora. It doesn't always cause pharyngitis. Once in a while, it can cause otitis media, which is a middle ear infection, pneumonia, and septicemia. Like strep A and strep C, it is beta hemolytic, and the gold standard for identifying strep group G is by serotyping it. All beta streps that are unknowns can be serologically typed with all Lancefield groups and to find its identity. So Streptococcus C and G are very similar metabolically. They're both catalase negative. They're both resistant to basotracin. They're both sensitive to SXT, and they're both CAMP and hippurate hydrolysis negative. They're also both PYR negative. The best way to identify Streps C and G is by serotyping them with the C and G latex. This brings us to the alpha hemolytic Streps. So the beta hemolytic Streps, we talked about Strep pyogenes, Strep agalactae, Strep C, and Strep G. Now I want to talk about the alpha hemolytic Streps. So today we're going to talk about Streptococcus viridans and Streptococcus pneumoniae. So most are considered normal upper respiratory flora. They are fastidious and capnophilic, so they do require 3 to 10% CO2 to get them to grow. They include such species as Streptococcus mitis, Streptococcus mutans, Streptococcus salivarius, and Streptococcus sanguis, but again, we just call them Strep viridans group. Okay, organisms are resistant to the optogen disc, so they're going to grow all the way up to the P disc, and they are biosolubility negative. Remember, the reagent for the biosolubility test is 5% sodium desoxycholate, and this causes Streptococcus pneumoniae to autolyse, but it will not cause Streptococcus viridans to autolyse. Streptococcus pneumoniae is also known as pneumococcus. It's an alpha hemolytic strain of Streptococcus that may or may not be mucoid, but usually the mucoid varieties are more virulent. They're pretty small colonies compared to Staphylococcus, and if you gram stain them, they're going to be gram-positive cocci in pairs, and they're going to be lancet-shaped. And what I mean by that is they're almost diamond-shaped because they start to stretch out. They may autolyse and appear gram-negative because they are so susceptible to autolysing. They are fastidious and capnophilic, so they do require nutrition and CO2. They will not tolerate refrigeration. The virulent strains are often encapsulated, and they have an anergetic substance called C-substance, which causes our CRP to go up, which is an acute phase reactant. Let's take a look at what Streptococcus pneumoniae looks like on a gram stain. So the purple dots are Streptococcus pneumoniae, and you can see they're not perfectly round. They are in pairs, but they're slightly elongated, and that's what we call lancet-shaped. So they're lancet-shaped gram-positive cocci in pairs, and usually you're going to see Streptococcus pneumoniae in the sputum or respiratory cultures. Colonies of Streptococcus pneumoniae may look like they have a penny edge. If you take a look at the isolated colonies in this image, you can see that they have a central divot, and so they're raised on the outside and they are kind of sunken in the middle. Diseases associated with Streptococcus pneumoniae would be bacterial pneumonia, and that especially occurs in people over the age of 55, bacteremia and septicemia, bacterial meningitis, otitis media, which is a middle ear infection, and endocarditis. And then also some things that make Streptococcus pneumoniae more virulent would be capsules. There are some strains that are mucoid and they tend to have capsules, and so they can't be phagocytized very easily by the human immune system. They also produce cytotoxins and autolysins. So Streptococcus pneumoniae is going to be positive for the biosolubility test, and it's also going to be sensitive to the P disc. We don't need to do both tests, we only need to do one. Either one of these tests is confirmatory for the identification of Streptococcus pneumoniae. Streptococcus bovis equinus galolyticus complex is also known as group D Streptococcus, even though we would not serotype them because they are not beta hemolytic. These are all alpha hemolytic Streps. Sometimes it's difficult to tell if you have an organism that's an alpha or a gamma hemolytic Strep, and so you would set up a bile esculin and a salt if you weren't sure. They're small colonies. They're either going to be aerobic or capnophilic. Streptococcus bovis is associated with colorectal malignancies. Now, the new name for that organism is Streptococcus galolyticus, and it is associated with colorectal malignancies. The Streptococcus bovis equinus galolyticus are all going to be positive for bile esculin, so they can hydrolyze esculin to esculitine, and they will not tolerate 6.5% salt like Enterococcus would. Our PYR and CAMP tests are going to be negative. So here's some images of bile esculin and salt. You can have bile esculin that are slants, and they start out kind of that OD green color. And as the tube turns black, we can say that our bug is positive for bile esculin. And then if you take a look at the image on the right, those are salt broths, and they are not growing. That means it's negative. And that middle tube is growing, which is a positive tube. So that is it for Unit 9. Today we talked about the alpha hemolytic streps and the beta hemolytic streps. Stay tuned for Unit 9. This was Unit 8. Stay tuned for Unit 9 where we talk about our gamma hemolytic streps. Have a good day.